Hey, good morning. This is Carlos Samaniego, and hey, today I wanted to talk to you a little bit Medicare related stuff. I had a situation that happened to me earlier this week that I thought was really important when it comes to picking your Medicare and whether you should pick your Medicare or maybe not pick your Medicare options. What you're looking here on the screen here is the scenario that happened to me earlier this week. I had a 68-year-old woman who was employed full time. She had full medical coverage, was paying about $350 a month for her health care coverage, and roughly paying just over $70 a month for her medications that she was taking. Well, she was talking to some family members, and some family members told her, she was 68 years old and she needed to go on her Medicare, and that if she went on her Medicare, that would save her, the $350 a month that she was paying for her health care through her employer coverage. And, to her, it sounded like, hey, yeah, I could really save, I'd love to save that $350 a month if I can get my Medicare. She already had Part A of her Medicare. She would just need to enroll into Part B and then decide how she was going to handle her Medicare, whether she was going to stay on original Medicare, get Medicare with get her Medicare with a supplement, or get a Medicare Advantage plan. So she again was talking to the family member, and they had spoke to an insurance agent, and the insurance agent had recommended her to go ahead and go with getting a Medicare Advantage plan. And with the Medicare Advantage plan that she was going to pick, her monthly premium was going to be zero. She would have paid, and I'll write this down here. She would have paid for her Part B, would have paid about $134 a month. That's approximately what she would have paid for her Part B. Now, you take the $350 that she was already paying. We're going to go ahead and subtract that $134 a month, and that leaves us, let me do a quick 134. So she was going to save approximately $216 a month, which comes out to over $2,500 a year. So, to her, it sounded like a great idea. You know what? If she would have went on Medicare, she would have saved almost $2,500 a month. However, something in her gut told her that maybe she should kind of look into this further. And luckily, I happened to meet her over at the Goski Senior Center earlier this year, and she kept my card, and she gave me a call and said, "You know what, Carlos, I'd like to talk to you in regards to what I'm thinking about doing." So I said, let's talk, and I met up with her at the Goski Senior Center, and we talked some more, and she told me kind of her situation, and she kind of gave me this scenario and what her family member and what the agent had told her. But I asked her a key question that was extremely important. I asked her, exactly what medicines were you taking? And she gave me the list of her medicines. Two of them were generic medicines, but there was one medicine that she said she was really worried about because she knew it was a very, what's the word that she used? The word that she used was, it was a very unique medicine that she had to take. And I said, well, what's the name of the medicine? And as you can see down here, the name of that medicine was right here. Excuse me. So it was an Affintor. It was an Affintor, 7.5 milligram tablets. She said she was really concerned about that. That was the one medicine that she was paying about $47 a month for with her plan through work. So I said, well, let's do this. I actually went to the Medicare.gov website, as you can see here, and you can actually look up the cost of the medicine. So I said, let's look up the cost of this medicine here. Came up with their zip code, and you know what? I'm just going to use my local zip code here because the price is not going to change. So we looked up the zip code. So with the Medicare.gov website, so what I was picking here, I was going to pick a Medicare health plan. she was going to go with a Medicare health plan that included Medicare Advantage, that included her drug coverage. And I knew she didn't get any extra help. So now this gives me the plan. If she currently had a plan, she did not have a plan yet. And now we just enter the name of the drug. And let's go take a look at how you spell that drug, Affintor. So Affintor, Affintor. There it is. And it was a 7.5 milligram tablet. She takes it monthly, and she gets it from a retail pharmacy. Now, normally what I do is I enter all the drugs, but I knew that the couple of other drugs were generic drugs, so I just wanted to see what the cost of this drug would be. So here we have the Affintor 7.5 milligrams. The drug list is complete for right now. Now, you have to pick the pharmacy that she goes to. It was going to be a CVS pharmacy, but you know what? I'm going to put CVS, and let's just go ahead and put a Rite Aid pharmacy as well. And that went to plan results. Now, right here, it gives me the list of the prescription drug plans that are available, the Medicare health plans or Medicare Advantage plans that are available. So she was looking at a Medicare Advantage plan that included drug coverage. So now what I'm going to do here, I'm going to look at all, it goes down here, and right here where it says View All, this is going to give me every Medicare Advantage plan that's available in the area. Now I have every Medicare Advantage plan that is available in the area. And it's being sorted by the least amount of expense. Now, I'll tell you, the plan that she was looking at, that she was planning on going with was... Actually, here's what I'm going to do. Instead of giving you the specific plan, because it really doesn't matter, I want you to take a look at here. Estimated cost for drug coverage, $13,000. $13,000. And this is starting with the least expensive cost for those drugs. 13,000, 13,000, 13,000, 13,000. So you can see every one of these drugs with every one of these plans are around $13,000. So what I ended up doing, and I'm just going to go in here, I'm just going to go with the first one here. Again, I'm not picking on any one of them. I'm just saying, let's go look at what the actual cost of the drugs are. Now, I go over to drug cost coverage. Now, take a look at this. The cost of this drug, actual cost of this drug, is $15,000. That's the actual cost of the drug, $15,000. So, this tells me right here, right underneath it, whether it's CVS, Rite Aid, or mail order, what her actual out-of-pocket cost would be for that drug. Look at what the out-of-pocket cost would have been for that drug for month one. $3,025. And then after she pays this $3,025, every month thereafter, the cost is $776 a month for May, June, July, August, September, October, November, December. Now, I found out that this was also a cancer drug that she was actually taking. Now, let me ask you a question. If her Medicare Advantage plan was costing her $0, however, her drug coverage costs was $3,205 for month one, and then $776 a month thereafter. How much money is she really saving? Again, over here, remember, she's paying $300.50 a month for her healthcare and medicines. Over here, $0 for her Medicare Advantage plan that she's taking. But her drug coverage she's going to pay is $776 times 10, 7,000. She's almost going to pay over $10,000 for the year just for the cost of her drugs. Well, obviously, we made a decision at that point in time that I asked her, do you have to get off your work coverage at work? She said no. So I said her best bet then is to stick with her work coverage because she's getting the Medicare coverage, or she's getting the medical coverage that she needs. She's getting her medicines that she needs. It's only costing her $350 a month. If she had gone to Medicare, it would have been $3,205 month one, $776 a month. Now, here's the thing. There are options, which I gave her, where she can talk to the drug manufacturing company and see if she can get a discounted price on the drug. She can talk to her doctor to see if there's other drugs available that she could actually use that might be a lower cost. But strictly from her current situation, this is the cost it would be. So that just goes to show you that the best thing to do is when it's time to look into your Medicare coverage is make sure you get sound advice from somebody that knows what they're talking about, that is looking out in the best interest of you. I hope that helped you, and thanks for now. I'll talk to you later. Bye-bye.